Ending death and suffering due to heart rhythm disorders is a lofty goal, but the trajectory is what's important. It's the constant striving and look towards solving these problems, creating new answers, creating new technology, testing hypotheses. That's what works so well. And so while we may not end all death and suffering, what we can do is work that direction. And we've gone a long ways that direction.
Our current EP section is one of the largest in the world, and it is sought after by patients from around the globe to come for first grade and world-class care in electrophysiology. And we do that through the best care we can provide, but also ongoing and continuing research, in addition to educating future leaders in electrophysiology. And I think those three things make the clinical section at the clinic one of the foremost and premier EP group in the world.
In the early 70s, we started putting pacemakers in as a cardiology group here and in the electrophysiology group. When I came here in 1986, the first 25 defibrillators had been implanted here, and I got to present them at the world meetings. But there are so many changes that have occurred. We've asked a lot of questions, and we've been at the forefront of solving a lot of those issues. We spent a lot of time learning about leads and how they fail, and then lead extraction and how to fix those failures, about infection and how to cure infection, about how to collaborate and solve problems. Now, we have had the privilege of being so much ahead of the thought patterns around the world that we get to lead the discussions about how to program, how to adjust, how to live with, or even how to die with devices. And the Cleveland Clinic and the section of cardiac pacing and electrophysiology has been a leader in that from as long as I've been here, for over 30 years.
Cleveland Clinic is a unique place, and I've had a chance to work at some very good institutions before, but this is unique in that it's a large group of people, very focused on patient outcomes. We're supported by the administration in achieving those goals, and there's a great deal of expertise within the group, so that when you have a difficult case, if you want to run it by somebody or a few people in the group, we help each other, we consult with each other. Sometimes cases are presented in our morning meetings where we discuss what's unique about them, what was challenging about them, and what we can learn from those. So I think in a group like this that sees a broad spectrum of very challenging cases, to be able to work together and to learn together is an advantage that most places just don't have.
Last year we performed 1,100 AFib ablations at the Cleveland Clinic with very, very low complication rates, much lower than the national benchmarks, and with very high success rates, also much higher than the national benchmarks. We also collaborate very well with our colleagues from the rest of cardiology and also cardiothoracic surgeons. And this has led us to do now most of our extractions in the hybrid OR with surgical backup. Another area we're collaborating and sets us apart from other people is also in VT ablation to provide better hemodynamic support, for example, when using the higher impeller outflow device or even ECMO or LVADs, so that we can get hemodynamic support to be able to do the VT ablation.
As crazy as it sounds, delivering high-quality care to our patients just isn't enough. Research is a core part of our mission. We're dedicated to expanding the horizon of knowledge in our field, both on the clinical side and on the preclinical side.
We've focused a lot on the genetics and genomics of atrial fibrillation. We have a great translational group that spans basic to translational to clinical researchers that have been working on this. We've had a biorepository for which we have gathered blood samples from patients with atrial fibrillation and other arrhythmias, as well as a human atrial tissue bank, which has allowed us to take genetic data and actually go forth with trying to figure out what the functional connections are between gene variants and arrhythmias.
Our mission with educating those who serve, certainly we have the commitment to our residents and fellows, but it goes far beyond this as well. Through our International Medical Education Center, we actually host a lot of visitors coming from all over the world, get exposure to new procedure, new surgery, new technique, new device. So we have two programs, for example, in electrophysiology. One is designed to be focused on device implant and lead management, lead extraction, and another one focused more towards ablation. And we customize them based on the needs of our visitors. Nothing makes us feel better than sharing what you find in the lab or during a procedure with somebody that you can communicate with. We learn from them and they learn from us. And the most valuable thing is we build friendship nationally and internationally.
We've got a great mix of people in our section in different stages of their career, and they all share that common passion for academics and for research and delivering the next generation of care and educating fellows as well. And so when you've got such a great mix of people that are committed and share that common goal, great things are going to happen.